Anything else you want to share about Daniel as to like why you'd recommend him or just your overall opinion?
He's been straight up with me from minute one, gave me all the information I needed, said do your own research if you need to. A lot of it is his demeanor, very calming, right? Very reassuring, very kind of, even keel. There's no salesmanship. There's no pitch. It's kind of like, this is what I have. I think you're right for it. It's up to you in the end. It's your situation. You know what's best for you. And then he has plenty of data, right? He didn't overwhelm me with data. He said, if you have it, I'm going to send you home with this. You think about it. And so, I went home, talked about it with the wife, and I said, what do you think? Is this, and then I did my own research, right? I kind of said, okay, I never heard about it. So I started digging in. Sure enough, it's gone back for many, many decades, and high-profile people have done it. And I'm not saying just because they do it, we should all do what they do. But if they're willing to kind of do some of that. And ultimately with him, he was just very knowledgeable, confident in his approach, confident in what his skill sets were. And he was listening to what I was saying, as if he asked me for my symptoms. What are my limitations? What am I experiencing? How did it get that way? I mean, how long has it been that way, right? Like, can you do this? Can you do that? We went through a range of motion exercises. We did, all the fact finding. Rarely do you get somebody that wants to get to the root cause of what you're dealing with and how can we fix it. All these things. I'm like, all right, this guy cares, right? He understands that this is your body and he's trying to make you feel better and he doesn't like you to see people in pain. And he manages expectations very well. And he's a small business owner trying to do the right thing and maybe something a little atypical than what most people do. So I was on board.